Welcome back to Living in Mexico. I'm Ana Maria Salazar. Thank you so much for joining us. I want to thank all of you who've been joining us throughout the years. It's been a long journey, trying to provide you information, news, analysis about what's going on in Mexico, both in English and in Spanish. Thank you so much. Um, we're going back to trying to take on issues that perhaps we've been putting aside because, as you know, on the show, we've been talking a lot about politics. We're in the middle of political campaigns, a lot of scandals, and to talk about also we talk a lot about corruption here on the show, but we're going to go back to one of the issues that I deal with a lot on the show, and it has to do with health and health issues, especially. It was almost our daily conversation as we all live through the COVID-19 campaign. That's why I really appreciate today's guest. He's joining us again, Dr. Mauricio Rodriguez. He is a professor at the medical school at UNAM. At one point, he was a spokesperson for the UNAM for everything that had to do with COVID-19 crisis. Once again, Doctor, welcome to the show. Let me just ask you a big general question. We are weeks away from spring break here in Mexico, Easter break. And it's always interesting to kind of figure out where we are in terms of health concerns and health issues. When you think about, we have an enormous drought throughout Mexico, very little water. There's a lot of, at least right now in Mexico City, the air contamination is horrendous. And of course, sometimes it's really cold, sometimes it's really hot. So I'm sure people are getting sick just because of that. Just kind of give us a sense where we are in terms of health issues that we should be paying attention to.
Yes, thank you, Ana Maria, for having me again here. It's always a pleasure, and I think it's good to put together what we are seeing in the health agenda these days, because it's important to mention that we are following a changing phenomenon related to measles.
Mm.
Since a couple of years ago, we are following what is happening with measles in all the world,
Mm-hmm.
particularly in the United States and in Europe.
Mm-hmm.
And in the last 2 months, things have changed because there was an increased number of cases in Europe, and
Mm-hmm.
there have been a couple of outbreaks in the United States, in
Mm-hmm.
Florida. There was one I think in Washington. Also, there's
Mm-hmm.
a couple of cases. And in America, in Latin America, there have been imported cases from Europe,
Mm-hmm.
which pose a special risk of local outbreaks because of the low vaccine coverage rates
Mm-hmm. Mm-hmm.
in all the countries. So we are keeping an eye on measles.
Mm-hmm.
Actually, in these days, the Ministry of Health in Mexico, the Secretaría de Salud, issued a travel warning if you are traveling to the United States or some countries in Europe and in Asia and Africa, to be
Mm-hmm.
aware of your vaccination status
Mm-hmm.
regarding measles.
Oh,
and
wow.
and once you come back to Mexico, you have to be aware in the next 10
Mm-hmm.
days in case you present some
Mm-hmm.
of the
But I
clinic.
think people forget how dangerous measles
Yeah.
can be. You know what I
Yeah.
mean? And it's especially dangerous for women if they're going to be pregnant or if they're getting pregnant, if they are pregnant.
Yeah, the problem with measles is that it's the most contagious virus in the world. So
Mm-hmm.
one person can transmit the virus to 16 people, in comparison to the influenza virus, which is one or two people get infected from
Mm-hmm.
one patient. But with measles, there's a very easy transmission
Mm-hmm.
among the non-vaccinated people in the community, and
Mm-hmm.
that provokes a lot of cases in a short period of time. So even if
Yeah.
it is not a complicated disease, the rates of complication is very low. I mean, there are one in perhaps 1,000, 10,000 cases, there's one or two complications. But
Mm-hmm.
if you have a lot of cases in a short period of time, you will have transmission in the community, and you will start seeing the complications because you will have a lot of cases
Mm-hmm.
And during the last 8 years, we have had low vaccine rates
Mm-hmm.
against measles. So we
Mm-hmm.
have a significant number of the population with no protection, and that, I mean, there is where the virus can go.
Let me ask you about influenza and COVID, and then I
Yeah,
want to ask you some questions about what some of these reports that came out in regarding the COVID-19 vaccine.
vaccines.
How are we doing with influenza and COVID? I mean, there seemed to be somewhat of a spike, but I don't know where we are right now.
Yeah, well, in Mexico we are seeing perhaps the last part of the season.
Mm-hmm.
We actually we saw the most intense activity of influenza by the first week of December, and
Mm-hmm.
since then we are seeing lower number of cases of
Mm-hmm.
influenza. COVID, we saw a peak already in January, perhaps
Mm-hmm.
January and the first week of February, but
Mm-hmm.
now we are seeing a decreased number of cases. We did not see hospitalization rates affected or deaths or something. In comparison with the United States, they have like 8,000 deaths per month
That's a
of
lot.
COVID. That's a lot. It's a
Mm-hmm.
preventable disease.
Right.
Have two excellent vaccines, and people are not getting the vaccines, and they have
Mm-hmm.
well, they had in January like 2,000 deaths per week,
Mm-hmm.
which is a lot. They have
Crazy.
30
It's crazy.
30,000 people in hospital with COVID. In Mexico, we
Crazy.
did not have not 300 people.
Mm-hmm.
I mean, it's a completely different situation,
Mm-hmm.
and also they have influenza, not in the rates that previous years, but they still
Mm-hmm.
having influenza. So in Mexico, we are seeing a relatively favorable situation in
Right.
comparison to the United States.
Well, let me ask you about the vaccine. There was some
Yeah,
reporting this week that there can be harmful consequences of using the vaccine, and I think it was overblown, particularly in one of the newspapers that I work with. I mean, they had these headlines it was almost shocking. It was like, oh my God. I mean, are we going to die because we got the COVID-19 vaccine? So the
yeah,
numbers were, I mean, I think the reporting was exaggerated. Can you just, and this is my last question, just put into context, what is the
yeah.
dangers of this particular
Yeah,
vaccine?
no, and thank you for having this topic on air, because there's a lot of misinformation regarding the safety of vaccines, and all the anti-vaccine people take this information to try to use and argue against the vaccines. No, so don't forget always to put in balance the risk and the benefit. Okay,
Mhm,
and there is a new report which evaluated about 183 million doses in almost 100 million people
mhm,
in 8 countries.
mhm,
And they made a specific pharmacovigilance program to see
mhm,
if some risk increased with the vaccinations or not, particularly cardiovascular effects and
mhm,
stroke effects. And they find that com- comparing with what was expected to have, some of the vaccines in some moments of the use in some populations regarding
mhm,
the age could increase the risk of having a stroke or a heart attack. No, when you see the frequency of those events, you
mhm,
see that they are extremely rare.
mhm,
And when you compare the risk of having those same events because of COVID, you see that it's a lot
Much higher,
higher
right.
than having because of the vaccines. And
Mhm,
this is
mhm,
something that has been very difficult to communicate to people, because
mhm,
of course there is risk, because I mean, if you
mhm,
drink a glass of water, is there is risk there. Okay, so the vaccines are not completely innocuous. There is risk if you are getting the injection and the liquids and the materials and all what is there.
But what you're saying, there's more risks in not getting the vaccine.
Exactly.
Much more risks
And
is, I guess, what the
that's why I
message.
mentioned that in the United States, they're still having 2,000 deaths per week because of COVID, because there is a confusion. And where is the risk? The risk is in the disease, not in the vaccine. There is risk in the vaccine, yeah. And perhaps we should accommodate and modulate how do we communicate the use of vaccines. And the other thing that we must consider is that the vaccines in Mexico are not for all the population.
Right.
And when we see possible risk and we see people that is saying, okay, I'm gonna put another dose and I don't need it, but anyway, I can afford it and I will pay for the new dose because it's the updated, and you said you don't need that vaccine. It doesn't matter. I can pay for it.
And I want it.
Yeah. And no, in Mexico, it's very limited, the populations which must be vaccinated, because the risk balance ratio in those population, it's always in favor of the vaccination. So I mean, that's all the elements that are in jeopardy when we talk about safety.
Let's do this. I ran out of time, but you have to come back really soon, because
of course,
we did not talk about dengue. We did not talk about, other health issues that I'm sure are going to be coming up because of the warm season, which is at least now in Mexico City, and it's around.
No. Let's prepare an intervention on that, and just to remind, peoples are safe, are useful, those are products with quality, the highest possible quality in pharmaceutical. So let's keep using.
Let's keep using them. It's so great to have you once again on the show, Dr. Mauricio Rodriguez. He is a professor at the medical school at UNAM, and he's been joining us throughout the years. Thank you so much.
Always a pleasure, Ana Maria.
Thank you. We're going to go to commercial break. I'm Ana Maria Salazar. You're listening and watching Living in Mexico. I'll be right back.